Sunshine, it's my sunshine.
I am Dr. VBN Prasad, consultant hip orthoplasty surgeon working in Sunshine Hospital. Today I want to talk certain aspects of the painful or problems of the hip in young people. Actually, problems of the hip in young people may be classified according to the etiology. Etiology means cause. Certain of the conditions may be congenital, may be infective, may be traumatic, may be developmental, and like this. So coming to the first order or the common things, developmental conditions. Among the developmental conditions, pethys is one condition in which the hip joint, which will have head of the femur and cup like acetabulum, these two things forms hip joint. In that, the head of the femur shape may be deformed due to some vascular problems in developmental condition, leading to a condition called pethys disease, in which the individual will present with pain and deformity and limp, and either X-rays or CT scan or MRI will diagnose the condition. Depending upon the stage, surgical intervention may be required. Next developmental condition in a child may be slipped capital femoral epiphysis. In this condition, the head or the epiphysis of the head, which should be in position, will gradually slips from the part of the neck, leading to deformity of the hip, and it will be manifested in the individual as a painful condition or limp or not able to walk properly. Sometimes it may manifest even as a traumatic condition like acute slipped epiphysis. In these conditions, X-rays will diagnose the condition. Sometimes CT scan may be required, and after diagnosis, surgical management, correction of this, and putting the proper screws to keep the head in position. After developmental condition, next comes the common ones are certain congenital conditions like dysplasias of the hip, which may be there since birth but manifest in the adulthood, maybe after 15 years or 20 years or 30 years, as a degenerative hip arthritis. In these conditions also, depending upon the severity of the pain, sometimes a surgical intervention may be required. Sometimes these conditions can be diagnosed in advance or before they are manifest. Certain corrective surgeries can be done on the pelvis and can be avoided. So after these developmental conditions, infective conditions are also may come in this age, though they are not very common. And these infective conditions may be again either septic arthritis conditions or tuberculous arthritis. In these conditions, severe pain, fever, sometimes loss of weight, and they will manifest in any other infective conditions of the body. And these conditions require thorough surgical debridement or cleaning of the joint, followed by antibiotics and further surgical definitive procedures. After infective conditions, these young people are also prone for a lot of accidents. So among the accidents or among the traumatic conditions, fracture neck of the femur, dislocations and fracture acetabulum are the next conditions, for which probably X-ray and CT scan gives the diagnosis, and proper surgical treatment, maybe fixation with the plates, screws may be required. After these type of developmental conditions, congenital conditions, traumatic conditions, tumor conditions also can occur. In this younger people, certain tumors like giant cell tumor and rarely malignant tumors like osteosarcoma, though osteosarcoma at this region is not common, I mean in the hip is not common, but still it can occur. Certain of these malignant conditions and benign conditions can occur, and they require orthopedic surgeon's intervention. And after traumatic conditions, certain metabolic bone diseases, certain unclassified things also can occur, and these things also will affect the hip, leading to pain and disabilities. Anyhow, hip joint forms a very important joint in the body, and that requires a thorough evaluation and proper treatment to get the individual happy. Thank you.
Sunshine, it's my sunshine.